I didn't have any interest in being a researcher at all, but I was looking for information I couldn't find.
Hello, I'm Jessie Young. I'm the chair of the research committee for the ACA Pediatrics Council, and I'm here today with Dr. Beth Carleo. And she is a faculty at Palmer, Florida, and she's been in private practice for 10 years. And today we're here talking a deep dive into her recent publication. Thank you so much for being here. And
Thanks for having me.
This conversation of outcome measures is one that I get very excited about. And so I am so happy to get excited about some.
Thanks for having me, Jessie. I'm very happy to share our work.
Yeah, so tell me a bit about the project, the paper, the project, and how it came about.
So this is a large team project that has been in the making for, I'd say, 4 or 5 years. We started with a large systematic review of pediatric conditions in manual therapy. And we started there. And then after we did that systematic review, we noticed that, the outcomes were not consistent across the literature that it's being published for pediatric manual therapy. And so we actually did a secondary analysis of that information in order to just pull out information and say, okay, there's these studies happening on pediatric manual therapy, but how are they measuring it? And is it consistent? Where are the gaps? Let's start to identify this, because of course we would love to make recommendations to clinicians and to people who are seeing kids in their offices. But in order to get there, we have to know where we are right now. And so this paper is a really important part of where we are right now in the literature when we're using tools.
Awesome. And can you talk a bit about what is a patient-reported outcome and why they're important? Like, why should doctors, benefits to the patients, the benefits to the doctors in practice? Yeah.
So I kind of put outcomes into 2 categories when I'm thinking about my clinical practice. I put them into subjective data and objective data. So patients' information that's coming to us from the patients and from their caregivers in the case of pediatrics, that would be where we would get our patient-reported outcome measures. And that's one piece of the puzzle. The other piece of the puzzle is the objective data. So what are we seeing as doctors during our exam? And I think it's really important, especially in the pediatric conditions, that we use both of those and that we combine that information. And so while patient-reported outcome measures is this big, long, scary word, all it means is that this is what the patient or their caregiver is telling you. So let me give you an easy example. We all talk to our patient parents about how they're sleeping, right? We all talk to the moms and the dads. How's your baby sleeping? How's your baby doing with crying? How are your baby's diapers? We're all talking to our patients about that. A patient-reported outcome measure is that information just in an organized way. So there could be a 24-hour crying time diary. And so it's information that we're already getting when we organize it and collect it in that way. We call it a patient-reported outcome measure. And this is information that comes from the patient. We add that to the information we're getting from our exam, and we use all of that in order to diagnose and treat our patients.
Yeah, you mentioned diaries for quality of life stuff, and you go nicely into your paper about that and how those are probably that and the visual analog scale are 2 of our best ones we have, right? And what we're doing in our chiropractic offices anyway. And so in a diary, like clinically, what kind of information, you mentioned crying times,
right?
What about what is important information to include when we're asking these parents to keep diaries? Does it have to be a formal, like published, like crying time diary, or can we make this stuff up as we go?
What a great segue, Jessie, because that's exactly what the paper is about, is that in the current literature, a lot of it is is being, not made up, but it's not necessarily a standard right now.
Right.
And so that's why we're doing the secondary analysis, is because 3 different doctors could be using 3 different kind diaries, and maybe none of those have been validated in any way or found to be effective tools. And so that's what this is all about, is we're trying to not only pull out the tools that are currently being used, but then we're trying to see, okay, did anybody ever look at those tools to see if they're valid, or if maybe there's a valid form and a not valid form, things like that. And so, we really found a lack of information when it came to these outcomes. And that's what this is about. That's where we are right now in the current literature. And so crying time diary, right now we're seeing different types. And in your practice, it could be any kind. But what we would love to do is get to the point where we're all using, really useful, valuable tools, and we're using similar tools so that data can be collected more efficiently.
Yeah.
And
if from my clinical, I'm in private practice as well. And if I had a list,
I know. Me too. That's why this started.
Yeah, exactly. And I just think, over the years I've collected these, but I don't have to evaluate them for their validity and reliability and all the things that need to happen. So yeah, this is the direction that you're moving us in, which is so exciting.
And just so you know, you're not alone. According to the literature that's out, the researchers aren't doing that either. So, and it's not just chiropractic. We're looking at anybody who's doing manual therapy in pediatric population. So this is across professions here. You are not alone if you are not using, validated studies. That's what we're seeing is happening in the literature. And that's what we're trying to identify so that we can give some guidance, really. But before guidance, you have to identify where you are.
Yeah. And you were mentioning this is just like manual therapy in general. Like, what kind of is anything better than nothing as we're doing our office visits, and poor quality outcome measures better than nothing, or and then kind of barriers that we have with, like, my practice is infants, and so I am relying on parent or proxy reported, which is even lowers the value even more, right?
Right. Yeah. So you hit the nail on the head. We already have this barrier, which is we can't necessarily talk to our little patients about how they're feeling. We have our exam data, of course, but we have to rely on the parent or the caregiver. And, that's already a barrier. So we have to collect the information as we can, because maybe a kid can't tell you they have a headache, but maybe their mom can tell you their behavior has been off 5 out of the 7 days last week, or, something like that. And so we already have that barrier we have to think about. The other part of that is you're going to get different opinions from different people, but I personally think any information is good information. And I say that as someone who's been looking at the literature, because maybe doctors in some instances didn't know what data they wanted to collect whenever they went into patient care. But in some cases, we're seeing that they do a retrospective case series, and because they collected similar data, they were able to pull that out and come up with a higher level, literature manuscript, as opposed to just one case study. So if you're collecting a lot of data, you might not even know why when you start, but maybe you look back and say, I have this information. This is showing up in my patients. Is there something there? And that's how research starts a lot of times.
Yeah. And where do you, before I pressed record, I asked if you had $1 million, like, what would you do? And where do you feel like our biggest gap? What's our biggest gap in pediatric research, and what can we do about it?
So when we talk about adding research or evidence into our practice, we kind of talk about these 3 things that we want to do. We want to take what the patient's preferences are into account, and we want to use our clinical experience to make decisions. And chiropractic does fantastic at those two things. We're really good at it. That's our sweet spot. We've been doing it forever. The third part is where we need help. And we need help in making sure that the literature keeps up with what we're seeing in our offices. So if I had all the money in the world, I'd probably keep doing similar to what I've been doing on a greater scale, which is getting teams of really like-minded individuals with different perspectives. I don't know if like-minded and different perspectives go again, but I would
get the same goal. Yeah.
Same goal, but maybe just different perspectives coming out of, to get to an end result. So I think these teams in research is really valuable in order to get some higher level research starting to get published. So I think that's what I would do with my money, is I would create these mega teams of really just valuable people in our profession. Awesome. And honestly, when I started, I did not think I was a person of value in the research realm. And so I would say to anybody who wants to be involved in any way, is you can join teams like this, and maybe you can get together with other doctors and figure it out together, and that can be approachable for everyone.
Yeah, with the Pediatric Council, ACA, we have mentor matching, which is a really great way to do, hey, I have an interest in, knee pain, and we can match you up with a researcher or, a seasoned doc that might that kind of team approach. And then for like someone like me, who I'm not a researcher, I am, and so what, we talk about with the ACA, we talk about, you can contribute to the literature in a lot of different ways. You can help fund it. So you can make donations, which we definitely have the ability through. With our Peds Council, we have a pediatric research fund currently. And so doctors who want to support it, but don't want to write the papers, can support it that way, which is a huge need. I'm sure you would agree with that too.
Yeah.
So funding is always a big topic. And what are some other ways that we can help, or that we can contribute, just as either students or just practicing docs out there, not skilled in research, not really interested in becoming skilled researchers, but know and appreciate the value of it.
Right. Well, I would just start by saying, if you're seeing patients, you are a researcher. So give yourself some credit. If you are following the standards and collecting data from patients and then performing some kind of a therapy and then getting outcomes, you're doing research. Absolutely. We're all doing it at different levels. And so just I think one of the first things people can do that can be of value is just keeping up with what's currently happening. And so maybe you are reading literature in your office, or maybe you're reading a paper and saying, I like that outcome. Let's take a look at it and let's see if I can smoothly transition that into my practice. And so there are little things. Funding for sure. I am a faculty member, and so it's part of my position that I do research, but a lot of us are doing this and not getting paid for it. And that's a huge barrier to getting more research out. When we have chiropractic research, we aren't dealing with the same amount of money that other medical professions are dealing with. And a lot of the stuff that's out there is due to very passionate people who are giving of their nights and their weekends and all of this. And so I think anything we can do to stand behind people who are publishing quality work, that can come in any way that fits into people's lives. And I say that because I didn't have any interest in being a researcher at all, but I was looking for information I couldn't find. I was seeing kid patients, and I didn't have an oswestry for kid patients, right?
Right.
And I thought, well, I know they're getting better. I'm seeing awesome results. Everybody I know is seeing awesome results, but how do we show people that?
Yeah.
And I looked and I talked to some of my colleagues and people I respected, and it's not out there. And that's what 5 years ago got me on this trajectory towards trying to gather that information so that we can get it out to our clinicians.
Yeah. Yeah. Something really similar with me, and like, how do I know I'm getting this infant better? Like,
Right.
mom's reporting less pain or they're growing, but at what point can I release from care? I'm definitely not a practice that I see people for, extended amounts of time. So the outcome assessment tools have been that for me clinically, like, oh,
Right.
we're at this point and now, we're improving, or what, we're not improving. And for me, it brings a lot of clarity, clinical clarity for that too. And even though they can be difficult to implement or manage, it's the value of that that's kind of what got me interested in it. And then realizing there aren't enough out there for what I, wanted to do. I'm like looking up, I'm like, oh, there's just nothing here for me to use. So
yeah, you're right. It brings clarity. It brings confidence, I think, in because our changes with chiropractic are really cool. And sometimes, especially with kids, they happen really fast. And so it's easy when you have a child to forget where you were 2 weeks ago when nobody was sleeping and we were crying 24 hours, and now you have a happy baby. And our memories kind of, heal very quickly. But, to gather that information is very helpful to us as clinicians to be able to say, this is where we were, this is where we are now. That's great.
Absolutely. That happens daily in my practice. Mom will say, how are you doing? Nothing's changed. And we look back, we'll look at the range of motion from last time, look at, crying to like all of these things and she's like, oh yeah, you were in an 8 out of 10 pain last time. And now you're at a 3, and 3 is still pain. So she's still in pain, right? Like, but wow, look at those improvements. And that can shift the whole plan for them and the whole outlook on their care.
I agree. And I say that as a doctor and as a patient, because even myself as a patient, I forget. We're supposed to forget so that we can move on and heal and keep moving. So
exactly.
Even I like to look back at my own outcomes and I think, oh yeah, I was there. I am better. Or like you said, maybe I'm not better and we need to do something different.
Yeah.
It's really important in making educated decisions about our own healthcare. And I think that's an important part of this.
All right. Well, is there anything else about your work in your paper that you would hope doctors would get out or take away from, or maybe questions that you hope that we
I think I just want to send out an overall message of literature can be overwhelming, research can be overwhelming, but like you said, Jessie, any little part that you are willing to engage with it is moving our profession in the right direction. And so maybe you just, maybe each doctor might need to find a topic that they really like and just start reading about it. Maybe it's as simple as that. Or maybe it's as simple as adding just one little extra question to asking your patients for an outcome. But it doesn't have to be big and grand. You don't have to change your lives. You're already doing wonderful things. We just really want to put some quality and data to all the wonderful things that are happening in chiropractic right now.
We're all doing wonderful things and we want to know about it, right?
Yeah, let's share it for sure.
Yeah. Excellent. All right. Well, thank you so much for your time. It's been really wonderful having you here to talk about this. And I am really grateful that you're doing this work, and really appreciate all that you've given to the pediatric literature. So thank you so much.
Thank you for everything you're doing. Whatever little bit I can give is nothing compared to what chiropractic has given me and my family. So I appreciate anything that anybody does. Thank you.